This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, here on Delmarva Life, we're all about you. So a couple of months, we launched a new series called Ask the Doc. We want to take care of those medical questions you might be a bit too bashful to ask your doctor yourself.
And nothing is off limits.
Nothing.
Okay, nothing. So that's why we're glad that we got a guy. This is our guy. This is Dr. Chris Snyder, the Chief Informatics Officer and Hospitalist with Peninsula Regional Medical Center. Thank you so much for coming in.
Thank you.
Thank you for being our guy.
Good to be back.
You are the man. The man among men. Okay, so first question, you ready?
I'm ready.
Okay. This was sent to us. I've been hearing a lot about heart health lately. My diet is not the greatest, and I'm a bit concerned. Is there any way to reduce plaque in my arteries?
Yes, the great question, because it's a known issue. Plaques in the arteries cause blockages in the arteries that go to the heart and give the heart oxygen and the brain. So prevention of strokes, vascular disease, et cetera, is what we're talking about. A lot of studies over the last 3 decades that have really identified dietary issues, especially a high-fat diet. If I could throw a pearl in there, one big thing you need to do is quit smoking. So smoking is a atherogenic, we call it, meaning it produces plaque. So smoking is one of those things that accentuates that. We all get plaques with age. So if you're 90 years old, you have plaques, hardening of the arteries, the old school way of saying it. Right. So, but aging in general causes plaque formation, so and it's a normal aging process.
So quit getting old and you'll take care of the problem.
Not going to happen.
That's not a good option.
Unfortunately, cigarette smoking accelerates that aging process. So that is probably the #1 thing anybody can do. If you don't smoke, you have genetics. We can't fix those. Mom and dad gave you what you have. But diet, and then the other thing, that big E word, exercise. So regular exercise. People say, you know, too much exercise is bad for you. No, the more the merrier, the more active the better. So daily exercise, whatever the recommendation is, but absolutely exercise, good diet, low fat, and then quit the smoking.
Stop smoking.
Quit the smoking.
There you
Okay, so the next question is, my 16-month-old son has severe eczema. We're treating him with prescribed cream and petroleum jelly. Can eczema have a long-term effect on him? That's a good question. A lot of people have eczema.
Well, the largest organ in the body is the skin. So it's called the integument system. So the skin is clearly one of those areas that can be dangerous. Eczema in its most severe forms can create basically a roadmap of redness throughout your entire body. So it can get to be very dangerous if not treated, and there's treatments beyond just topical steroids. The average individual has an episode of eczema. It can be an allergic reaction, or it could have some genetic role too. So, but eczema is an inflammatory process of the skin, and clearly getting involved with it sooner than later, not letting it go, is important. Any kind of burn that you have of your skin, sunburn for example, can be very dangerous. Again, the largest organ in the body is your skin, so you have to take care of it. You have to use a sunscreen, etc. But eczema is one of those things that it could be dangerous. If you get cracking, it can lead to infection in the eczema. And eczema can cause some significant damage to the skin too, as far as scarring.
What about diet? Can diet help eczema or treat it?
Diet's one of those things that clearly has an effect on it. Exercise too, back to our atherosclerotic changes. So blood flow is one of those things. If you don't have good blood flow to an area, it's hard to resolve an issue in that area. So the blood is the basically fountain of youth for that area, and it will help clear it up. So there's folks who were obese in the past who've exercised, dieted well, lost a huge amount of weight, find that their skin is one of the first things in their hair that have an effect, a positive effect on your body because of your diet and activity.
How about that?
Well, I didn't know that. Okay, next question. I don't want to talk to my doctor or anyone for that matter about hemorrhoids. What do I do?
Yeah, hemorrhoids are a common problem, and it can be in both men and women. So there's no specific gender relation. Women tend to have more of a problem with it. Right. But hemorrhoids are one of those things that are very uncomfortable. And if they're bleeding, also have a risk point for rectal cancer and multiple other rectal diseases, Crohn's disease. There's a million colon diseases that you have to worry about. A lot of times hemorrhoids can be related to nutrition again and activity. Obesity and poor nutrition definitely drive the effects that you can have. And basically a hemorrhoid's a large rectal vein that pops down. So as that vein gets more stress on it from whether it's inappropriate bowel movements or obesity, just the gravity pressure from obesity can create those problems. So it's a common problem a lot of people don't ask questions about. If you're close to 50 and you're having hemorrhoids and they're bleeding, you need a colonoscopy. If you're close to 50, you need one anyways. So, you know, again, my biggest concern is people ignore it and then have an underlying cancer in there that could be missed.
It could be just a typical problem, but it could be something more serious, so
Absolutely.
it's best to talk to a doctor about it.
Yes, get it
All right.
evaluated, have somebody take a look, see what's going on there. And there are curative procedures for hemorrhoids that don't resolve with topical therapies.
Okay. All right. And finally, or not finally, we still have another question. It's not a medical question, but I think it's a question a lot of us ask. How can I tell my doctor that his wait times are ridiculous? I waited up to 45 minutes just to get into a room, and then I wait again. I'm sick of it, pun intended.
Yes, literally. Yeah, that's a very challenging. Doctors run businesses. You know, I think every business has to have a quality assessment. You know, it's one of those things that we go to medical school not to run a business, but to be doctors. But there's this unknown non-understanding, I should say, by physicians and their staff. I think healthcare has gotten a little better with that, but we still have a long way to go. Business ethics, appropriateness of a customer service branch of your office, I think is really important. I think if you have an office that you walk in the door, you can pretty much tell if they have decent customer service or not. A lot of folks don't see themselves as customers, they see themselves as patients. Right. But that's changing. I know at Peninsula we have a very strong customer service branch, and if there are issues, tell us, we need to know. Yeah. A lot of times we're so busy in the back we forget about the front. You know, I think some organizations do a real good job with greeters and making sure that people get access. But access to healthcare, we have a long way to go. So, but be honest with your provider. Tell them about the front office. We need to hear about it. Don't be afraid to say that. I want to know what's going on out front.
But be nice about it.
Absolutely. Yeah, I mean, you know, there's suggestions. You want to know what's coming through the door and how you're being treated, because it's very important. That's the beginning of the care that I give in the back end of the office.
Okay. All right. Now this one, it's not really a medical question either, but it's kind of along the same lines. I can't afford some of the medicines my doctor prescribes, but I'm embarrassed to tell him. Do I have other options?
Real problem. People not getting their medications. You know, you come to us for help. It's important. So, and that goes both ways. I think you have to make the effort. We're all responsible adults. We have to. If I give you a recommendation, it's your choice to pick it up. The cost is prohibitive in many cases. I think a lot of us try to do the best we can with that, but there's this invisible world of formularies out there that is very challenging when you have 200 payers in a state, and that's the insurance companies. It's very difficult sometimes to know which drug in which class is being paid for or not. And the cost prohibitive nature, the pharmacists are really the experts there. Unfortunately, when I prescribe, they're not sitting with me. Now, with the onset of electronic medical records, there is some visibility around that that's really improving. So hopefully in the future, we'll be able to determine cost before you prescribe, especially I'm a hospital medicine doctor. I send folks home on some pretty prescriptive, expensive stuff. And honestly, to keep you out of the hospital, I need you to get that. Yeah. At Peninsula, we're focusing on pharmacists at discharge, helping you understand that risk prior to leaving, and also understanding the cost benefit, the cost relationship too, because we know it's expensive. We pay for meds too, by the way. I'm a patient too. Yeah. So honestly, when you pay for meds, you have to realize there's an expense with it, but it's very, very challenging.
You're not running a scam by trying to prescribe the most expensive thing you can. You want them well.
Yeah.
Absolutely. We prescribe based on science. Unfortunately, the cost is the other end that we actually get nothing related to that. Right. I think there's this misperception that we like expensive drugs. No, the cheaper the better for us, because I want you to take it.
You don't like that, I understand.
Absolutely.
All right.